A community organization is gearing up for a vote that could have a big impact on public health and public money. Central Health is the health care taxing district for Travis County. Each year, members of its Equity Council vote on one policy they'd like to focus on. This year, the top two contenders are improving data gathering in Austin and improving health care for the LGBTQ community. KXAN's Tahera Rahman reports what might change in clinics.
Every single time I go to the doctor, I have to weigh when I'm going to tell them and how to kind of bring it up.
It's not an uncommon struggle.
We hear a lot from the LGBT youth. The doctor assumed that they were having heterosexual sex, or they were never asked if they needed to get an HIV test.
According to the Human Rights Campaign, 56% of lesbian, gay, and bisexual people have experienced discrimination in health care. That number goes up to 70% for transgender people.
How do we create environments where people feel safe and secure and know that they can disclose that they're part of the LGBT plus community and know that they're going to get the same kind of service or that they won't be judged?
Central Health is looking into changing that throughout Travis County.
Pursuing the Human Rights Campaign Health Care Equality Index.
Right now, only 2 clinics in Austin are accredited through the Human Rights Campaign. This week, members of a Central Health coalition will vote whether to make that accreditation across all clinics the priority for 2020.
We'd probably have training so that our providers are more equipped, and there would also be more benefits for same-sex couples when it comes to medical decision making and health care for their children.
This is a great step to take. Once you normalize this, then we can start working on some of the other issues as well.
Tahera Rahman, KXAN News.
The council may also decide data gathering should be the 2020 priority because having more accurate demographic numbers might inform future priorities. The third policy on the table is to ban all flavored tobacco products in Travis County. A Central Health spokesperson says their early research ranks that idea as the least feasible. Members are set to pick a policy tomorrow morning at 9 o'clock. Tahera mentioned only 2 clinics in Austin are accredited with the Human Rights Campaign right now. People's Community Clinic is one of them. The center was listed as a 2019 LGBTQ healthcare equity leader. RBJ Public Health Center is also accredited. In 2017, Central Health's Equity Policy Council helped ban vaping in public spaces in the city of Austin. They worked on the ordinance passed by city leaders prohibiting electronic smoking devices anywhere where tobacco smoking is banned.